Warm regards, respected judges. Myself, Dr. Abhay Kulkarni, Reader, Pediatric Dental College, Solapur, and PhD scholar, Sivaga Dental College, Pune. My topic of presentation is an instantaneous angle for an extensive broadcast. Introduction. Metabolomics is a study of metabolites, which are small molecules generated by the process of metabolism at cellular level, tissue level, or of whole organisms. The study enables the analysis of a wide range of metabolites, which include substances like lipids, peptides, amino acids, nucleic acids, vitamins, organic acids, carbohydrates, and thiols. Nicholson defines metabolomics as the comprehensive quantitative analysis of all metabolites of an organism or a specified biological sample. The term metabolic profiling is also used simultaneously. Metabolomics refers to absolute quantification. The study is designed for unique chemical fingerprints of low molecular weight metabolite profiles. These are indicators of physiological or pathological states and can provide information for the identification of early markers of a disease and help to understand its occurrence and progression. According to the most recent data reviewed by Milonsky et al., out of 1840, almost 500 metabolites have been identified in the oral cavity and 359 found in saliva. Saliva offers many advantages compared to the other biofluids, as it can be collected safely with less training and can be produced on demand. Despite of many advantages of saliva, it is considerably less studied for metabolic profiling compared to the fluids such as urine and plasma. Saliva contains a larger repertoire of proteins, 50%, and peptides, 80%, which are found abundantly in plasma too. This is a consequence of exchange of molecules with clavicular fluid at the periodontal pocket of the sulcus through passive diffusion, pinocytosis, and fusion pores of acinar cells. This way, saliva can be a very important biofluid regarding hormonal, immunological, nutritional, and physiological status of an individual. Salivary metabolite analysis is a non-expensive, rapid, and inexpensive strategy with promising potential in clinical diagnostic procedures. Since cellular metabolism is altered by diseases, the resulting metabolic effects may serve as a biomarker for any given pathophysiologic condition and also can be implemented for a mass screening easily. To detect metabolites, methodologies available are gas chromatography MS, solid phase microextraction, needle trap microextraction, thin film microextraction, stir bar soft tube extraction, direct injection mass spectrometry. Gas chromatography hypernated with mass spectrogrammetry, that is GCMS, one of the most popular analytical platforms for volatile metabolomic profiling and considered as the gold standard of metabolomic research. As the name suggests, in this methodology, the volatile metabolites are loaded in GC column and separated metabolites then detected by mass spectrography. The samples that are not volatile under normal condition can be derivated to make the metabolites thermostable and gaseous at the higher temperature. Compared with other analytical tools such as liquid chromatography, mass spectrography, and capillary electrophoresis mass spectrography, gas chromatography mass spectrography, that is GCMS, is one of the most efficient, sensitive, and reliable tools for metabolomic studies. GCMS produces reproducible molecular fragmentation patterns, making it an integral tool for metabolite identification. GCMS has shown high separation efficiency, which can resolve very complex biological mixtures. This technology identifies and quantifies a few hundred metabolites in a single sample. This review attempts to find the role of salivary metabolites in systemic and oral diseases. Aims and objectives: to do the review, easily approachable methods and usefulness of a salivary metabolites as a diagnostic tool in a various diseases. Methodology: online PubMed, Google Scholar, Scopus search was done by using the keyword salivary metabolites, metabolomics, oral cancers, and salivary testings. Review of literature: Kulkarni E. Hirschberg et al. Tested 120 salivary metabolites from 110 individuals, that is 43 healthy, 37 hepatocellular carcinoma, and 30 cirrhosis. 4 metabolites were significantly different between the 2 or more groups. Acetaminophen was significantly decreased in patients with cirrhosis and significantly decreased further in patients with hepatocellular carcinoma. Octadenol was also decreased in both groups in comparison to healthy control groups. They concluded that metabolites detectable in saliva may represent products of disease pathology or a breakdown in a liver function. Shobharsidhant et al. Included histopathologically confirmed oral squamous cell carcinoma and oral leukoplakia patients and the control group, and found 15 compounds differ significantly between the controlled oral leukoplakia and oral squamous cell carcinoma. Some were decandoic acid, 2-methyl-octasone, echiasone, octane, 3,5-dimethyl, pentadecane, and heteroctane. Others are listed below. Marina de Silva et al. Investigated first-time salivary metabolites in South Americans salivary metabolite samples from 27 oral squamous cell carcinoma patients and 41 control individuals were compared and allowed identification of pathways of the mallet aspirate shuttle, the beta-alanine metabolism, and Warburg effect. However, they claimed further studies are needed with a larger population. Leone and Raffer et al. In their study found out of 84 saliva metabolites, 9 were positively associated with 5-year tooth loss. Across all analyses, the metabolites 2-pyrrolidinic acid and butylputresone were almost considerably candidate metabolites, likely reflecting oral dysbiosis. Other metabolites likely reflected tissue destruction and cell proliferation, and concluded that untargeted metabolic profiling of saliva replicated metabolite signature of a periodontal status and revealed novel metabolites associated with periodontitis and the future tooth loss. Fidalgo et al. Concluded that the children with caries lesions presented higher levels of several metabolites, including lactate, fatty acid, acetate, and N-butyrate, and permanent dentition presented increased levels of acetate saccharides. Their data in children showed similar salivary metabolite profiles for a healthy subject despite the differences in the oral hygiene habits, socioeconomic status, and food intake. Asad et al. In their systemic review stated that out of 140 salivary metabolites reported common were alanine, valine, and leucine for cancers, while proline, theanine, and histidine in combination and monoacylglycerol alone demonstrated the highest for breast cancer, combined with choline, betadine, piperacolic acid, and L-carnitine showed better discriminatory performance for early oral cancer. Goku Sridharan studied salivary metabolic profile in oral leukoplakia and compared with the normal controls. Significant upregulation of mainly spinganine 1-phosphate, pseudoiridine, and some others in oral leukoplakia and oral squamous cell carcinoma was noted, while downregulated compounds in the diseased groups included uremic acid, estradiol valerate. A range of salivary metabolites were significantly altered in oral leukoplakia and oral squamous cell carcinoma. Ravindra Taure et al. In their study of volatile alteration in head and neck cancers through salivary metabolites studied 59 human subjects and identified 48 volatile organic metabolites. The metabolites were significantly different from healthy controls. The clues from the metabolic analysis indicated that short-chain fatty acids might have significant role in head and neck metabolism. Daniel C. Mueller et al. Studied saliva of smokers and non-smokers for metabolites obtained from 24-hour diet control clinical study. They could identify 13 significantly altered metabolites in smokers. Most of the identified metabolites, including tyramine, adenosine, and glucose 6-phosphate, could be linked to the smoking-related perturbation and may be associated with established detrimental effects of smoking. Zaivi et al. Explored salivary metabolomics in oral cancer and oral leukoplakia in healthy patients. Valine, lactic acid, and phenylalanine in combination yielded satisfactory accuracy, sensitivity, specificity, and positive predictive value in distinguishing oral carcinoma from the controls or oral leukoplakia. The utility of salivary metabolome diagnostic for oral cancer is successfully demonstrated, and their results suggested that metabolomics approach complements the clinical detection of oral cancer, leading to an improved disease diagnosis and prognosis. So our allocation in the group of the study, which we have done, was 50 patients of clinical histopathological diagnosis of oral squamous cell carcinoma, 50 patients diagnosed clinically as oral submucous fibrosis by Nagesh and Bailur criteria, 50 patients with a habit of tobacco chewing, smoking, or smokeless without any oral mucosal lesion, and 50 patients non-tobacco users that will be counted as a healthy controls. Method of selection, inclusion criteria: patient diagnosed as oral cancer, patient diagnosed as oral submucous fibrosis, patients using tobacco, smoking, smokeless but not having tobacco lesions, age, sex match controls, patients willing to participate in the study and given informed consent, signed consent. Exclusion criteria: patient undergone recent treatment of oral cancer. Patient who are under the treatment of oral submucous fibrosis and has any taken treatment in the past. Immunocompromised patients, HIV infected patients, patients having systemic diseases, patients with salivary gland diseases, patients with PDL loss, that is loss of clinical attachment more than 5 mm, and pregnant and lactating women. The variables, dependent variables are salivary metabolites. Independent variables are oral submucous fibrosis, oral cancer, tobacco user, and non-tobacco users. The procedure: patients will undergo oral hygiene prophylaxis 2 weeks prior. Patients will be seated in a dental chair examination. Case record will be done. Briefly, the saliva samples will be collected at 9 a.m. to 12 noon. Eating and drinking not allowed at least 2 hours prior to the sample collection. Each subject will thoroughly rinse their mouth and water. The selection of the patients: group 1, group 2, group 3, and group 4. All the patients will then collection of the 5 ml unstimulated saliva by spitting method and rinsing the mouth with chlorhexidine mouthwash. Then storage in a sterilized glass vial and transportation of a saliva sample by minus 80 degrees centigrade. And then the samples will be processed for gas spectrometry, mass spectrography. This way, the samples, labeled samples, will be given and the patients will be asked to spit in the vials. All the vials will be then transported and then will be recorded at the center. So this is what the gas chromatography mass spectrometer, which has been used, which is NAC accredited. The results are seen on the gas chromatography will be recorded like this, and all the volatile and non-volatile metabolites will be recorded. The similarity, the gas chromatography machine has got its own library, and whatever the metabolites which are being seen in this procedure, above 70% similarity will be chosen as that particular metabolite, and that will be counted as a metabolite. Below 70%, which won't be counted in the list. So till this date, we have done this much of a data. Oral cancer, 3 patients, we have found 25 metabolites. Oral submucous fibrosis, 2 patients, we found 20 metabolites. Tobacco users without lesions, 3 patients, we have found 24 metabolites. Non-tobacco users, 3 patients, we have found 13 metabolites. This data is scanty, but whatever data we have collected, it is showing that number of metabolites are increasing as the stage is advancing from the control, that is non-tobacco users, to the group of a cancer. So ultimately, the salivary metabolites, these are increasing as the tobacco use is increasing. And once the tobacco is increasing and the patients are affected with the pre-cancer and again the cancer stage, the number of metabolites are increasing. The data, even though it is quite scanty, it is still indicative of what results we are going to get in future. Conclusion: the salivary metabolic profile is a mirror of the body, as it can provide a general outlook on significantly changed metabolites from aberrant enzymatic regulation, capture the oncometabolites originating from the metabolic rewiring, and highlight altered pathways. All these can become ideal metabolite markers indicating the ongoing oral premalignant lesions, oral squamous cell carcinoma associated changes, and diseases without obvious pathological symptoms. It can be considered as a risk indicator of various diseases. However, it has got limitations that the concentration can be diluted to some extent because of a continuous saliva secretion and mainly by the major salivary glands. My references. Thanks and regards. Thank you very much.